Welcome to the second video in the Training Toolkit series. This video answers the question, what is EHDI, or EDI for short? EDI stands for Early Hearing Detection and Intervention. It's a program whose mission is to identify and provide services for children who are deaf or hard of hearing. The South Dakota EDI program joined the South Dakota Department of Health in 2015 to create the South Dakota EDI Collaborative. The newly formed partnership allowed for federal funds to facilitate quality improvement activities within the South Dakota EDI program. EDI programs across the nation strive to achieve what is called the 1-3-6 benchmarks to assist with its mission statement. The 1 stands for 1 month. All infants should be screened for hearing loss no later than 1 month of age, preferably within the first 24 hours of life before hospital discharge. If the infant does not pass the initial screening in one or both ears, the child should be rescreened within the first 2 weeks of life. It is important that the child only be screened twice before progressing to the next stage. The 3 stands for 3 months. If the infant does not pass the screening and rescreening in one or both ears, the infant should be referred to a pediatric audiologist for a diagnostic audiological evaluation. This evaluation should be completed no later than 3 months of age. If the infant is found to be deaf or hard of hearing after this evaluation, additional testing is recommended. This might include testing for congenital cytomegalovirus, or CMV, or sending the infant to genetics or ophthalmology, for example, for further evaluation. The 6 stands for 6 months. If the infant is diagnosed as deaf or hard of hearing, the infant should begin receiving early intervention services no later than 6 months of age. This intervention will look different for each child and depends on the family's preferred mode of communication. The child might be fit with an amplification device, such as a hearing aid or cochlear implant, or the child might begin receiving American Sign Language services. Before newborn hearing screening was instituted universally, children with severe to profound hearing loss on average completed the 12th grade with a 3rd to 4th grade reading level and language levels of a 9 to 10-year-old hearing child. In contrast, infants and children with mild to profound hearing loss, who are identified in the first 6 months of life and provided with immediate and appropriate intervention, have significantly better outcomes than later identified infants and children in vocabulary development, receptive and expressive language, syntax, speech production, and social emotional development. Hospital staff plays a critical role during the initial screening and potential rescreening. If the child passes the initial screening, but displays risk factors for hearing loss, which will be discussed later in the video presentations, the child should have at least 1 audiology assessment by 24 to 30 months of age. In addition, if the family is concerned about hearing or communication, a repeat hearing evaluation is recommended. If, however, the child does not pass the initial screening, the medical provider should facilitate a visit for a rescreen. As was mentioned before, it is important that the child only have 2 screenings before being referred to a pediatric audiologist for a diagnostic audiological evaluation. As a healthcare provider or clinician working in the birthing facility with newborn infants, your role is to realize that you serve as the entry point for families into the EDI process. Ensure that all newborns are screened for potential hearing loss prior to discharge, consistent with the national guidelines. Ensure that infants who do not pass their initial newborn hearing screening receive referrals for rescreening, and/or an audiologic evaluation from a pediatric audiologist for more comprehensive testing. Inform families of the results from this screening in a manner that conveys the importance of timely and appropriate follow-up, yet clearly states that a screening does not diagnose the infant with a hearing loss. Answer questions or refer them to someone who can to provide support for families as they enter this first step of the EDDI process. Provide parents with education regarding newborn hearing loss, risk factors for hearing loss, and the importance of screening, follow-up, and early intervention. Ensure accurate and timely documentation of the screening results and referrals. Communicate the need for referral and rescreen to the infant's primary care provider or pediatrician. And obtain and document valid and accurate parent contact information for reminders and follow-up post-hospital discharge. A bundled approach to care involves the implementation of a set of evidence-based practices grouped together to improve the process of care. A bundled approach to improve the early hearing detection and intervention program is represented by the acronym TSST EARS. These training videos are accomplishing the first step in the acronym, T for train. Your next step would be to screen the child. Please advance to the third video in this training series to learn about protocols and procedures for newborn hearing screenings in the birthing facility.